Overactive bladder, OAB syndrome, is a chronic medical condition which has a tremendous impact on the quality of life in both men and women. OAB affects performance of daily activities and social function such as work, traveling, physical exercise, sleep, and sexual function. A condition with characteristic symptoms of urinary urgency, usually accompanied by frequency and nocturia, with or without urgency incontinence, in the absence of urinary tract infection or other obvious pathology. Urgency is the key symptom in diagnosing OAB, and it is closely associated with frequent daytime desire to urinate, nocturia, and incontinence. Nocturia is reported as the most bothersome symptom. Nocturia was found to be directly related to decreased sleep quality, decreased health-related quality of life, and depression in the elderly population. Diagnosis of OAB is considered in the absence of urinary tract infection, metabolic disorders affecting urination, or urinary stress incontinence generated by effort or overexertion. Only a third of OAB patients show urge incontinence, also called wet OAB. This is different from incontinence due to failure of the urethra and pelvic floor to withstand abdominal pressure that is usually not accompanied by urgency. Some patients may have both OAB and urinary stress incontinence symptoms and are diagnosed as having mixed urinary symptoms. Theories as the neurogenic theory, reduction in the inhibitory neural impulses and increase in the afferent impulses from the bladder trigger the voiding reflex. The myogenic theory, the detrusor muscle becomes more sensitive to cholinergic stimulation, leading to increased spontaneous activity. The autonomous bladder theory, alteration or exacerbation of phasic activity is generated by muscarinic stimulation. The afferent signaling theory, spontaneous bladder contractions during filling result in increased afferent output, and hence the awareness of bladder filling. All these theories attempt to explain what is referred to as detrusor overactivity. The micturition reflex is activated when the detrusor muscle is stretched, while control of the bladder is achieved through a complex of interactions between the central and the peripheral nervous systems. OAB syndrome pathological conditions affect the bladder's sensory pathway and contribute to the urge to urinate at a low bladder volume. The detrusor muscle is densely innervated and allows synchronous activation and a rise in bladder intravesical pressure. A pathological partial denervation of the detrusor may induce muscle contractions, leading to an urgency sensation and possible urge of urinary incontinence. Anatomically and functionally, the detrusor muscle phasic activity is also controlled by the autonomous nervous system, and any imbalance in the excitation or inhibition of smooth muscle modulators may also result in detrusor overactivity. Recently, novel molecules can cure these type of overactive bladder. For further information and management and treatments, connect Dr. Sanjeev on WhatsApp 9323275869.